Okay, we will give the number to Dr. Anjum Qureshi. Dr. Anjum Qureshi is here.
Yes, sir, Anjum. Can I share the
Yeah,
screen?
carry on. Thank you. Thank you.
Give me a minute.
Thank you, Doctor. Thank you, Doctor. You may share your presentation, and we are welcome to you. Now you may present your presentation. Thank you.
I hope my screen is visible. So I will be speaking on policymaking in healthcare, and I'm Dr. Anjum Qureshi from India, and I'm assistant professor at the Department of Electronics and Communication at Rajiv Gandhi College of Engineering. So here I will be speaking about how policy making is important in healthcare. Because if we talk about the goal of health policy, it is to protect and promote the health of the individual and the community. So the government officials they can actually accomplish these objectives in the ways that respect human rights, including the right to self-determination, privacy, and non-discrimination. And the WHO defines the health policy as the decisions, plans, and the actions that are being taken to achieve some specific healthcare goals within a society. And when we talk about the health policy, we should be considering the public health, the mental health, as well as the healthcare insurance. And when we are framing the healthcare policies, we should be thinking about few questions like what should be the components of sound health policy and what is the best equipped to solve which health policy problems and why and what do data policy bodies need. So, firstly, let's just see what will be the role of the citizens in the health policy. Because everyone, regardless of profession, is a stakeholder in public health policy. So it is not that only a health professional or a doctor or any care of any person working in the healthcare field, or of course, they are having a special role, but you can influence the health policy by researching and publishing on the topics that you care about, by identifying and indicating areas where policy is needed and creating connections with the colleagues in your field of engaging them in meaningful dialogue and working to your full potential and maintaining your intellectual curiosity and volunteer to participate in the policy making meetings and continue to engage with relevant literature and speaking out against the ill-advised policy and also playing a great role in promoting some sound policy. So when we want to make a health policy, of course, we need research. In fact, research is the base of everything. So and when we are working on the health system, the health system research, if you say, it will have two components, the health system and the research. So the health system will include the structure of the health outlet that like the primary healthcare facility or the primary healthcare centers that we have in the rural health centers or the secondary healthcare facilities that you'll be having like the district hospitals and all. And the health system research that is related to the prevention of some kind of disease, its treatment, and also its promotion within the national health system. And that is carried out by the institutions on the basis of social, economic, political, and cultural aspects. So, when we talk about the health system, yes, it plays a very significant role because there is a risk when we neglect the interest of the community or there is a lack of understanding of the problems at the grassroots level in the existing system. So, the health policy is wrong. So, we need to have a balanced approach, and to achieve this, there should be an access to the community so as to understand the basic problems and to understand their needs and to design the necessary strategies to solve the problems reflected in the health policy of the country. And the main objective of the health system research is to bring about improvement in the health of the people by increasing effectiveness and efficiency of the healthcare system. Therefore, there should be continuous identification of the problem and also there should be evaluation of the existing systems that are working. So, compilation and analysis of the facts and figures will facilitate the development of a strategy for the future to meet the shortcomings and to meet the shortcomings and which will ultimately improve the efficiency as well as the effectiveness of the health system. Importance of research in policy making. If you see the WHO, it says that it actually emphasizes the importance of the use of research in policy making to drive improvements in the health services and population health and well-being. The World Health Report 2013 mirrored such thinking by stating the aspect in policy and practice. Health research should be embedded as a core function of the health system. So the health policies are based on objectives and they provide guidelines for the achievement of certain targets in the health sector. And because research provides basic information to the policymaking process, it is important that the research should have close.
Wait, wait,
Any problem? Should have close correlation with the health policies of the country. Because if the research is, we are not doing any research related to the health policies, then I don't think that there will be an effective linkages with this, and it will be really be able to address the health development sector of the country. In fact, it will just lead to underutilization of the service. These are the key areas for effective health, public health program implementation. First is innovation. This should be encouraging research because when we see when we are encouraging innovation, it's something right from the level. And when we encourage innovation right from the school level, then we eventually reach the higher education. Of course, there will be more of innovation. Anyone does the thing, there should be some kind of labs or some kind of research facilities that should be there. There should come, and in fact, this is only because of the innovation that we have advanced in the health sector all around the world. Then comes the technical package. Okay, if I have some innovation in mind, but we should be knowing how you have to incorporate technology into it. However, we know that the technologies like the AI and IoT, they have used to make the health system better, and it has even the doctors those were very burdened to take the readings and all. Now their work is really simplified with the use of technology. So yes, technical package should be there. Then the political commitment is required because we know that they have a very important role in making the policies and enforcing them. So the political commitment is required in that. Then comes the communication. Communication is the policies that are made for the people. So it should be properly communicated. The people should be knowing what are the health policies that have been made for them, why they have been made for them, and how they are going to use it. So sometimes this communication is there is a communication gap due to which the people are not able to use the policies and the schemes that have been made by the government. So this communication should be there. It should be encouraged through a lot of awareness activities. Then partnerships, because in the healthcare sector, we know that there are some health systems working at the public level, some at the private level. Then there are some NGOs and the voluntary organizations who are helping the government or the private sector. So there should be collaboration between they should be knowing to work together. And then what kind of policies are being implemented, there should be monitoring and evaluation for this. Of course, we have to plan for, but after once it gets implemented, there's monitoring and evaluation of these policies. And then we are making any health policies. So these are some of the points which I should actually do. First will be professionalism and ethics that is very important in any kind of field that we know. Then the policies that are being made, and at that time, everyone should be considered. Everyone should, whether it is a man or it is a woman or they are children, they are senior citizens, whether we are making policies for some critical illness, any kind of all the kind of situations, they need to be equal importance. Then affordability, that is a very big problem because there are the health systems have advanced, but there are many modern treatments that are not affordable by the people over here. So it should be affordable. The quality of care. The quality of care, that I would like to give an example. It is not just important to have a hospital, but your hospital should be equipped with all the modern facilities. It should be having a proper required amount of staff. The quality of care, collaboration that already discussed, and pluralism here. If a company has different types of treatment systems, like in India, we have along with the allopathic system, we have Ayurveda, we have Siddha, we have Unani. So even this kind of treatment systems should be encouraged. So that is where pluralism should also be considered. Now, when we are making the health policies, there can be at different levels. We can have policies for women, we can have policies for children, we can have policies for senior citizens, we can have policies for workplace. But here I have just considered like how, with the help of a workplace, how health policies will be working at a workplace. So health policies, they are nothing but just a formal statement that have been written, but it has some rules for the people, we can say. So when we are talking about workplace rules, these are some statements that have been designed to protect and promote the employee health. To support you, workplace health policies, they will affect large group of workers simultaneously. They can create and foster the company culture of health. And if some of the policies, we can just an example that the policies that prohibit tobacco and alcohol use at the workplace, or they where it is made mandatory that although employees should be served quality food at the company meetings, the policies that are not health related may have severe health impacts on the people working with them. So when the health policies are being made, the organization are saying that they are not investing on, they're not spending money on making or implementing these policies, but they are actually making basic investments in the human capital. So, some essential components of the health policy in the workplace, there can be employee wellness programs, then there can be encouraged with some kind of yoga, meditation, or any kind of exercises. Then the employees should be provided health benefits like they can be having sick leaves, the maternity leaves that they're having, and they should be encouraged for having the work-life balance. Like the minimum and the maximum hours of working, this should be defined. And mental health support, because nowadays the people are more they are mentally imbalanced. Mental health problems are emerging a lot. So mental health problems should be considered. Safety regulations and emergency response. So, okay, there should be a safety, safety from fire. But it is not that they should be knowing that, okay, there is a fire extinguisher. But even any kind of emergency areas, they should be also knowing how to protect themselves. In the workplace design, yes, it should be properly ventilated. There should be enough amount of light so that the people enjoy working with them. And of course, substance abuse and addiction policies should be there. But there are also some kind of challenges when we try to implement the health policies at the workplace. First is like financial, that I already discussed in the earlier slide, that the people think that they are spending money on implementation, but they should understand that they're actually investing in the human capital. Then the organizational hierarchy, sometimes it becomes a blockage in implementing this policy. Then how a program is designed, because when we are designing a program, you should be considering the problems, especially at the grassroots level. When we fail to consider this, so this programs we face, communication and participation should be there, and of course, evaluation and measurement, that was again very important. Then the policymakers, they have to have this view test that they should examining the public health interest. They should examine the overall effectiveness of the policy. Like, is the proposed policy likely to be effective in achieving the stated goals? And they should evaluate whether the policy is well targeted, is the proposed policy narrowly focused on health problems. They should be identifying the human rights burden, and they should also examine whether the policy is the least restrictive alternative. So we can say that when we are implementing a policy in any healthcare system, it depends upon the provider's commitment, and the policies that do not address the organizational profession and the social economic context are unlikely to achieve successful implementation. That is, political objectives done, however well-intentioned, are inadequate to change the practices. So, when barriers to policy implementation exist in any of this context, the policy we face is addictive. So, we need to address the challenges, and we need to come over so that we have good healthcare policies in our country and we ensure good health. So, this is all what I had from my side. Thank you very much for your patience listening. And these are some of my references that I have used for making my. Thank you very much.
Sir Irfan, please unmute yourself. We cannot listen you.
Sir Irfan, you are muted. Please unmute first.
Thank you, Dr. Anjum Qureshi, for your valuable presentations. We really inspired from your presentation. If you have any question from audience, you can do it. That's why Dr. Anjum Qureshi is here. If no question, we can move